Hello, everyone, and welcome to another entry of the Coronavirus Diaries. Today, I have my good friend here, Chandler. Me and Chandler go way back. We've been friends for a long time, and Chandler is nice enough to be our guest today for this episode. So, Chandler, can you please, for the audience, introduce yourself and tell them what you do and where you're located as well?
Yeah, so I work at a allergy and asthma clinic in Lakeville, Minnesota. I'm a physician assistant there. So, yep. And now we're based in St. Paul, and that's one of the areas affected by COVID-19 in Minnesota.
Okay. So Chandler, can you kind of describe how the coronavirus pandemic kind of affected your life and your work life?
Yeah, so if we're divided personally and professionally. Personally, we're trying to keep our distance from family and some friends as well. Um, we're also following the governor's orders for stay at home. We're doing our best to, try to social, physical distance ourselves for, a period of time, and then kind of going with that. Professionally, I guess we are doing screenings like a lot of other clinics. Some clinics are even shutting down, but a lot of clinics are staying open and saying, hey, if you have a cough, fever, shortness of breath,
Hmm.
we're going to ask you to call in and kind of get a screen and evaluated, see if you need some additional help or COVID testing, that kind of thing. We are still seeing patients, particularly because we're an asthma clinic as well. That means that we're seeing high risk patients. So people who would, if they were to get infected with COVID-19, it could be a lot more dangerous for them than the average person. So we're considered an essential clinic for that. We're also starting to get into telehealth visits. So our computers now recently have installed various programs that allow us to do visits through video. And then we can also do it through phone as well. So, yeah.
Okay. Um, so I guess so clearly, since you're an essential worker, um, how do you kind of cope with that when everyone else is kind of working from home, and you know?
Yeah. Well, that's a good question. I mean, for us, nothing's changed. So it seems, kind of normal. We see some people preferring online visits as opposed to in-clinic visits, which is reasonable. But Anastasia and I both know that, our jobs are important, and we're not in the highest, we're going to do everything we can to stay safe and healthy, but ultimately we're not in the high risk group, and that gives us some comfort as well.
Okay. And then kind of walk me through the process. Like, let's just say a victim kind of comes in to your office. They said they might have the coronavirus disease. What would you have to like? How would you react to that?
Yeah, so hopefully they wouldn't actually come in to our clinic because we don't have testing like, say,
Okay.
Gregory just would. When,
Sure.
and we don't have a drive-through clinic there, but um, we did have a patient call who did have COVID-19 over the phone, so they didn't come in.
Okay.
We don't encourage that. But that allows us to treat them for their asthma as well. For example, if they need additional medications that would help in the short term, such as, maybe recommend using their rescue inhaler more often, or if needed, a prednisone burst is a common treatment for asthma exacerbation. So hopefully they don't come into clinic, but if they have asthma, they can still call in and we can treat them for that.
Okay. What kind of medicines do you kind of prescribe, I guess, or your doctor kind of prescribes?
Yeah, so we primarily see mostly asthma and allergy patients. People with allergies aren't necessarily, well, I take that back. I'll just say that asthma patients are at a high risk for um, having a, worse reaction to COVID-19. They're more
Hmm.
prone to, get a more severe illness, and that might require hospitalization, that kind of thing. But on our side, we prescribe pretty much the same medications, but you know, we're a little, maybe a little bit more lenient because we don't want sick people coming into the clinic.
Mm-hmm.
But we're still, practicing within our scope and not, you know, prescribing inappropriately either.
Right. Is there any kind of advice that you'd kind of give to our viewers to maybe kind of prevent them from getting the COVID-19?
Yes. So everything that they've been saying, please
Mm-hmm.
follow. Um, Symptoms include fever, cough, shortness of breath. If you have any of those, even if you have some other symptoms like muscle aches, fatigue, sense of smell, taste, that's come out recently as well. Please stay home. Isolate yourself if you have the ability to be tested. Um, please do. Don't go and just show up at a clinic. Please call first so we can properly screen you and triage you. And also, social distancing, physical distancing is very important. This is a primarily respiratory illness. So it does spread through, coughing, sneezing within a certain distance. So try to keep your bubble around you. And then obviously washing hands, not touching your face, that may help too. So.
Okay, very cool. So Chandler, is there anything else you would kind of want to add that you haven't kind of gone over already?
Yeah, I guess just to add on to that, so COVID-19 can be very dangerous for certain people and populations. We know it's really dangerous in the elderly. But following these rules, even if you don't feel like you're in danger yourself, for the sake of others, please do try to follow the guidelines that the governor and the CDC has laid out as well.
Okay, and then I guess I kind of want to get your opinion on that. Because Governor Watts, I think it was yesterday, had that new rule implemented. How you kind of, what's your opinion on that?
Yeah, I think that's an excellent way to do it. Minnesota has particularly done well on social distancing. I think I read one article that said we're actually the best in the country, which makes me feel good about ourselves. But
let's go Minnesota.
Yeah. So the order is, I believe it's 2 weeks shelter in place, followed by 3 weeks social distancing with everybody, and then after that, kind of physical social distancing with high risk populations. So people over 60 or whatever those guidelines say, and then people over a certain age with asthma, COPD, heart disease, that kind of thing. I really agree with that, because you'll notice that once hospital ICU beds, ventilators, when those types of things get overwhelmed, that's when the mortality rate goes up. So anything we can do to flatten the curve and keep as many beds available for people as possible and not have everyone get all sick at once, I think those are good guidelines to follow.
Very nice. And then I guess another kind of question is, like, I know you lived in like downtown St. Paul, where it's a little bit more crowded. How is that? Can you kind of describe me like the atmosphere, like maybe how your apartment is kind of reacting to the situation, or what they're doing?
Yeah, so similar to other apartments, all our communal rooms are closed, which is, understandable, kind of sad,
Mm-hmm.
but understandable. But there seems to actually be more people outside. And I think
Yeah.
that's because, people are still trying to get the exercise in, weather's getting a little bit warmer. So that's good, because mental health is also important. And, being by yourself in a room can be damaging for certain people for mental health. So it is good that people are getting outside and trying to maintain their distance and that kind of thing.
Cool. All right. Well, thank you, Chandler, for your input here. So guys, if you like this interview, please like, subscribe, share to our channel here. And then, so yeah, thanks again, guys. And until next time.